I am at Brown University with Dr. Kathleen Hwang, who is an assistant professor here of surgery and pathology. Her focus is specifically on male infertility, and more specifically, she does research related to fertility preservation in men and the epigenetics of male fertility. So it's really great to talk with you today. I think let's get started talking about fertility preservation. So this has been a pretty big buzzword around, particularly for women, about freezing their eggs. What is fertility preservation, and what is it for men?
Sure. So fertility preservation has definitely been something that's been more focused on recently in the past decade or so, with sort of the advances in cancer treatment and sort of the improved cure rates. And so pretty much now the focus is on quality of life issues such as fertility preservation. So for adult men, prior to having treatment with either surgery, radiation, and or chemotherapy, the idea is to have them bank sperm prior to any of that gonadotoxic therapy starts. And so they have, quote unquote, as an insurance policy of having some sperm freeze that they can use for future paternity.
Okay. So this is primarily in cancer, in situations where someone is diagnosed with cancer, and before they go ahead and get treatment, this is a way to make sure that after that they survive and that afterwards they're able to go on and live great, happy, normal lives and have their children.
Exactly. So before really the focus was on sort of the improvements in sperm cryopreservation and freezing sperm, the only real options after patients were treated heavily with cancer chemotherapy or radiation was either using donor sperm and or adoption.
Okay.
And so there are a lot of men who would really want to have that ability to biologically father their own children. Mm-hmm. And sort of the advancements in sort of the ability to freeze sperm and have them viable and have really, really great success at healthy pregnancies, live birth rates, are really changing the way that we can sort of help men preserve that ability.
Are there other circumstances, other conditions in which men might want to consider fertility preservation?
Absolutely. So the whole premise is that you can freeze sperm for any manner of reasons. And so a lot of patients who have decided that they just want to proceed with a vasectomy as sort of a sterilization technique, but want to know that they still have some sperm frozen just in case they change their mind. Mm-hmm. The other options, for vasectomy reversal, there are times when during the vasectomy reversal, sometimes they don't work. It isn't 100%, and so you'll take some testicular sperm during that procedure and freeze it just in case the reversal procedure doesn't work, and then they can use that frozen sperm for using assisted reproductive techniques such as IVF or ICSI.
Okay, wonderful. So let's get into some of the mechanics of how fertility preservation works. You get sperm, and then you freeze sperm. These are these two steps. So
two basic things.
Let's talk about getting the sperm.
Of course. So for the vast majority in adult men, it's ejaculated sperm. So they can masturbate and it's collected into a sample cup, which then gets processed in the lab. Okay. Now, based on sort of the high acuity of timing, based on when they're needing to start cancer treatment, sometimes that just doesn't work out. Sometimes based on their prior diagnoses of cancer or any other type of thing, sometimes they don't have sperm in their ejaculate. Okay. So then you're then at that point forced to look at different options. Okay. Other options, depending upon whether if they have no sperm in the ejaculate, would include a surgical procedure where we would do a sperm extraction called a TESE, a testicular sperm extraction. At that point, you would be able to go into the operating room and open up the testis and harvest some sperm and then freeze those as well. Okay. Other options, depending upon if patients have spinal cord injury and they don't have the nervous system to kind of be able to ejaculate appropriately, there are options including penile vibratory stimulation, which would help ejaculation, as well as electroejaculation. So there's many different techniques on how we can help achieve that sperm harvest. Okay. So you take those sperm and then you freeze them. What are the steps that go into preserving sperm? No, so absolutely the technique of sperm freezing has actually been around for centuries. I think the first person who actually did it was in the 1700s. Oh, wow. And quite frankly, in the beginning, it was terrible, right? Not a lot of the sperm survived the freeze and the thaw, just based on how fragile the membranes are within a tiny, tiny sperm cell. But over the years, the ability of developing cryoprotectants, so things such as glycerol, if you freeze the sperm and expose them to a protectant, it actually protects the sperm from the change in temperature, dropping to freeze it, and then the thawing process as well. So in this day and age, quite frankly, you get the sperm, it gets processed, it gets exposed into a cryoprotectant, and they're frozen in separate vials.
Okay.
And so you anticipate how many numbers of sperm you're putting in each vial, and whether or not it's going to be frozen for IVF ICSI, which needs a significantly fewer number of sperm.
Okay.
Or if you're going to be trying to freeze for intrauterine insemination,
Okay.
where at the end of the day you need much larger numbers in the realm of 3 to 5 million motile sperm. So once you designate what kind of vials are going to be frozen in, what straws, however many number, it's basically placed in a large cryoprotectant tank. It's in liquid nitrogen in the vapors, and it's a significant protocol that has been sort of evolved and sort of finessed over the past 5 or 6 years. The process of freezing and thawing itself is not 100% perfect, right?
Okay.
So with one freeze-thaw cycle, people have shown that you will lose up to 30 to 40% of the motility and or viability of the sperm.
Okay.
For somebody who has completely normal semen parameters, that might not be that big of a deal. If you
Right.
start out with 50 million, you have plenty left to use over. For men who have much lower numbers, who are falling into the severely low count number, that is a big deal. So you have to consider really how many vials you're going to have to counsel them to actually preemptively save
I see.
before.
I see. Are there factors in the freezing process and thawing process that enhance sperm life?
So it's still an ongoing process where people are still trying to figure out what that perfect protocol is to sort of minimize the loss of sperm with the freeze-thaw cycle. A lot of it has to do with using different levels of cryoprotectant, whether it's the glycerol, they used to use DMSO. There are all these different things in picking out what ratio of which cryoprotectant to use. There are newer techniques out there as well as sort of like vitrification as well, and similarly with egg freezing. But nothing's perfect, and so people are really focusing on that well, because that's one area that really could have a big difference if we could freeze sperm and you get 100% of it at the end of it. That would be amazing.
Well, I think it's amazing that we get and I mean, you're freezing this stuff and then it just comes back to life. It's like kind of Frankensperm.
It's amazing. And you're a little concerned in the end when this started to happen with like, fine, they look alive, but what happens when you're actually trying to create embryos and seeing if they go full term? Do they miscarry? Do they have higher rates of birth defects based on the fact that the sperm were frozen and then thawed? And quite frankly, the results and the sort of the evidence-based sort of publications are showing that the birth rates are not much any different than average birth rate for a natural person conceiving.
Wow. So I was surprised to hear that it's possible to do IUIs.
Yes.
With frozen sperm.
Yes.
I have never heard that.
Yes. So the sperm prior to being frozen need to be pretty darn good. Right. They need to have really robust mobility, ability to swim well, and pretty robust numbers as well. Because as you said, you lose a good portion of it in the freeze-thaw cycle. But if you started with 50 million sperm and you lost 30% of it, you're still back down to a good, decent number that are actually motile. And so you only need roughly between 3 to 5 million motile sperm to be considered a pretty good candidate for insemination.
Wow.
Yeah.
Wow. That's incredible. Are there other factors that would say which kind of pregnancy technique following someone having cancer? So they have cancer, they come out, they're good, they had great sperm. Now we're trying to figure out, because there's a limited number, so you only have so many tries.
Right.
What are the guidelines for helping people figure out what to do?
So part of it is you have to take in consideration the entire couple. It takes two people to get pregnant, and while the male partner, if we're talking about just him having the cancer, that's one factor, one piece of the puzzle.
Right.
The other factor you have to consider is his partner, the female partner. Are the eggs healthy? What sort of age are we looking at? Are there any other female factors that would take into consideration as well? The higher level of concern with female factor as well is you do less likely to, with the insemination, want to move more towards the ICSI if the eggs weren't working as well. And ICSI is sort of intracytoplasmic sperm injection, kind of the most technologically advanced way that we can help couples achieve pregnancy.
Okay, good.